everyone. So today I've got Dr. Sunil Richardson. We are going to be addressing few of the doubts that our inpatient and outpatient patients generally have. So we have categorized it as general, and the other category is it is related to the jaw surgeries, and the third one it is related to rhinoplasties. So we are going to start with the general questions that we face on a daily basis. So sir, the first question that I would like to ask: how does facial aesthetics relate to function, chewing, breathing and speech?
Hi, namaste to all from Richardsons Face Hospitals. So the question is, how does facial aesthetics related to function, right?
Yes, chewing, breathing, speech, everything.
Yeah, so face is between the forehead and the Adam's apple around the ear. So, you have the eyes, so obviously vision, nose, breathing, smelling, teeth, chewing, tongue, tasting, opening the mouth, ears, hearing. So there are multiple functions on the face. So that's number one priority you have to understand. And so I have this philosophy: when you treat patients with facial issues or facial concerns or facial desires or anything the patient has, the first thing that I would like to consider is that the philosophy, which means that function is the most important. Following a good function, then you can look at the symmetry of the face. So you draw a line in the midline and you make sure the face is symmetrical. And then the more important thing in terms of aesthetics, also proportion. So how proportional is your face per se? Does it fit in the golden ratio? Do you have the nose matching well to the jaws? How is your jawline in comparison with the proportion of the nose? What does the lip do? How is your smile? How is the eyebrow? What happens to the various subunits of the face? So that is what we call as a proportion. So to answer this question about the intermingling of the aesthetics with function, function is most important. And very often you see that in nature, you see that everywhere. Someone is attractive or something is beautiful that generally has good proportions, good function, and therefore aesthetics is also good. So I tend to look at my patients with the functional aspect first and foremost, then looking at the asymmetry, because you need to have some amount of symmetry, and then the proportion. So we try and tailor each one of these things subtly in order to get that face that the patient is desirous of, or the improvement that we can give these patients.
Next question that we generally face is that what are the most common facial deformities that we see in our practice on a day-to-day basis?
Facial deformities that we see today, they're diverse. We see all types of deformities. And I think if I can think of deformities and kind of put them in some groups. So there are kind of deformities that the patients have from birth. So birth deformities, craniofacial issues. Then there are deformities that patients get due to an accident. So you meet with an accident, scars or some issues with the nose, breathing, whatever. Deformities that arise out of accidents or trauma. Then there are deformities that come out of a tumor surgery, maybe a cancer surgery or a benign tumor surgery, whatever, that needs to be done in order to save the patient's life or in order to make sure the patient doesn't have functional issues. So you can have deformities arising out of that. And fourthly, we also see patients that have deformities that have arisen or that have come out of an earlier surgery done elsewhere or probably done here, but whatever the surgery is the reason. So you're probably doing a surgery to get a better jawline, but something doesn't go well and you get a deformity. Or you're trying to correct a birth deformity and the birth deformity doesn't get corrected fully and a deformity persists, whatever that is. So that's the fourth part, I would think. Now, I see a lot of all of these patients in our practice on a regular basis. I used to treat a lot of kids and adults with birth deformities in my earlier years of training and my earlier years of private practice, both craniofacial, cleft, various types of deformities that kids have, that adults have it as they grow. But with years, we also have in more patients now that have come to us post-cancer reconstruction, post-malignant tumors, post-benign tumors, all kinds of concerns. Various tumor sections have been done. I think this is because probably more people are aware of the work that we do now, but also because of various factors that are playing. It's multifactorial. Today, typically, if we do about a 50 or 100 surgeries a week, and then we think there are different types of deformities that fill in, post-traumatic, birth, all of these patients are there. We treat them on a regular basis.
Sir, so next question that we asked is, since we are a face surgeons, we are doing surgeries on a face. How is it possible that we avoid scars or we get a very minimal scar which is hardly visible?
Yeah, that's a very, very common question asked by a lot of my patients. Also because, they come to me saying, Doc, I have this bad scar. So how do you remove it? So I say scar revision. It's not scar removal. I mean, what I'm trying to say is we can improve the scars very often when patients have scars. But to answer this question, I think I'll have to start this way. So we tend to do a lot of surgeries by avoiding totally the facial scars. For example, you want to work on the jaw, then we work from inside the mouth. You want to work on the nose, we work from inside the nose. You want to work on the eyelids, we work from inside the eyes. So I think that's one very common way that we avoid scars. Totally, exactly. The other thing is we also tend to place scars, as you'll know, incisions in various areas of the face, which tend to leave, I wouldn't say a visible scar, but it tends to leave an inconspicuous scar. So a scar is basically not going to be visible. For example, a preauricular scar or a scar around the alar base,
Yes, sir.
a scar around the columella, a scar on the side. So we tend to put the incisions to approach in regions where the scars are going to be less. I think that's the second reason. The third thing is because of so many developments that keep happening. Now, for example, we used to take a big strip of hair on the back and then suture it up and then cut those follicles in place here. But now we use the robotics, we use the FUE, so we don't need to make the incisions at all. So technical advancements have enabled us to also reduce a lot of the scarring. Another example is endoscopic surgery. So we can make a small incision and reach far down, either with your bicoronal or an endoscopic approach. So I think technological advancements, various gadgets that have been gotten into our practice, the development in anesthesia.
Along with that, the thickness of the sutures that we use is...
Yes, absolutely. So yeah, that's very correct. So you can go for very fine sutures, very good materials available today.
Yes, sir.
Fine work, yeah, I think still is the most important thing. Yeah, but then I think, yeah, it's a very good question. So we use multiple options like these in order to, give patients results without giving them scars.
True, sir. So since you mentioned fine work, my next question is, what does it take to be a good facial surgeon? And also, can one surgeon do both hard tissue and soft tissue work?
Yeah, in one word, yeah. So I think it just depends on your training. When I started my training, I was very concerned and very unsure as to whether I'll be able to learn this and that and everything. And my dad told me one thing. He said, you can train a monkey in any field in life. And I thought I was a monkey because, it's like this. So you got to probably take it one at a time. So for example, you want to do the bony aspect of the facial work, then you can take that, master yourself, add a skill set, go on, get another skill set, you keep adding it. And surgery, as you know now, because you've also been with me for a while, it is a skill which you can't unlearn. So if you learn that skill, it's like that particular thing is open for you. So then you move on. Now, if you look at it though in the medical world, so you have these orthopedic surgeons, they only take care of the hard tissue. Then you have plastic surgeons, you pretty much take care of the soft tissue. They call plastic surgeons because they're not working with plastic, but because you're working with things that are moldable.
Yes.
Yeah, so that's the reason. And then you have some other different types of surgeons who work region specific. So you have gastroenterologists, you have the cardiac people and everything. So the concept of face being an organ is not so much so in vogue right now. It's not so much that people know. So I think the face can be considered as an organ, like how you would want to consider the face or the heart or the liver or the kidney. And then on the face, so you have the bone, obviously, you have muscles. So you got to definitely have skills in both the hard tissue and plastic surgery or soft tissue. Yeah, so I think it's doable, it's trainable. You probably have to go to different places to learn different subunits of these surgeries. I mean, that's what happened with my surgical training as well. So from my basic maxillofacial and then craniofacial training, both Indian abroad, and then going on to learn different aspects of rhinoplasties and mastering it out, and then doing different types of orthognatics, combining that with some tumor surgery, doing different types. So yeah, so I think the main understanding here is that it's absolutely possible. It might take longer. It's not that you cannot do it. So if you are an aspiring surgeon from whatever branch you are, you're a plastic surgeon, you want to do bony work, absolutely possible. You are an ENT, wants to do both, that's possible too. You're a maxillofacial wanting to learn plastic surgery. Today it's possible. Everything is possible. I think you need to take some time out, go to the right places, get to the right people, learn, spend time, and then keep learning. So yeah.
Okay, sir. Thank you so much, sir. So these are the set
Are we
of,
done?
yes, general questions are done.
Okay, thank you.
Thank you so much. So next we'll be starting with jaw surgeries tomorrow.
We
Thank
have
you.
okay.
Okay, that's it.